Talks between family doctors and the Quebec government over Bill 2 have now fallen apart. Both sides saying the renewed negotiations broke down Thursday. Starting in January, Bill 2 requires doctors in that province to meet performance targets to be fully compensated, with penalties for physicians who do not comply. And while the province says reform is needed to improve healthcare, doctors say this bill could force them to shut down their clinics for good, including our next guest. Dr. Mark Bush, medical director and co-owner of Santé Montréal, a family health clinic in Montreal, is joining us this morning. Welcome.
Thank you.
So just to set this up for everybody, under Bill 2, 10% of Quebec doctors' pay is going to be tied to performance thresholds that are set out by the province. Those include doctors being required to collectively offer more than 17 million appointment openings per year. Let's start there. What effect could that target have on patient care?
Well, our biggest concern is that this turns primary care into what we call fast food medicine. You know, if you only have a certain number of hours in the day where you're able to provide care because of family concerns, because of other hospital commitments, that will be forced to cram multiple patients into a short half-day clinic or a full-day clinic. And the only way to increase the number of spots available would mean to rush patients through their appointments.
And what would be the penalties if you don't meet the targets?
So our understanding is the government's going to remove a portion of our remuneration starting January 1st to be given back to us if we achieve metrics that they are imposing on us, a portion of which are collective. So I think people need to understand that some of these metrics are in areas of care where I have absolutely no impact as a clinic owner or as a family physician. So some of these metrics are province-wide. So if a physician in Baie-Comeau is unable to achieve their target, for example, because they're ill or they go maternity leave, well, all the family doctors in the province will not be eligible to receive their full compensation.
So physicians who push back against these new rules will face, as you mentioned, financial consequences. Doctors who protest the changes with concerted actions like reducing how often they work could be facing a $20,000 fine per day. As a family doctor who is running a business, what message is the government sending to you?
We just don't know. I mean, this is almost out of a novel from communist Russia. It just makes absolutely no sense. The amount of control and fear and, frankly, blame. We are quite hurt physicians this time. We're hurting as a people. We went into this profession. It's a vocation to heal people, to stand up for our community, to take care of patients, to take care of the most vulnerable in society. And here we are being told you're the problem with access to healthcare in the province, which is completely untrue.
Paraphrasing the government's take on this, they are saying because family docs are in part paid by, or are paid by the province, they should be able to dictate the metrics. What's your response to that?
Well, they kind of already do. We've had metrics dictated to us for over 20 years. People aren't aware with some of the bureaucratic hurdles we have to go through in Quebec to even practice. We have something called the PREM system, which is a regional permit system where the government has to approve you to work in a particular area of Quebec. You must work over 50% in that area or you're not given your full remuneration. For the first 15 years of our practices in family medicine, we're obliged to do what are called activités médicales particulières, which are 12 hours a week of tasks that are done outside of the office. So, for example, working in the emergency department, taking care of inpatients, delivering babies, working in long-term care facilities. We must do those in order to receive our full compensation, or our remuneration is deducted by 30%. The government passed a law about a year or two ago dictating to us which patients we can take into our practice. They must come from an official government waiting list without certain exceptions. I mean, there's just more and more red tape. And in our contract that we have with the government to become a family health group, or a groupe de médecine familiale, as they're called in Quebec, we actually have a contract that we sign where we're obliged to be open 64 hours a week. We're obliged to give appointments to patients who don't have family doctors. We're obliged to take care of our own practice. We're actually followed by that, we have a fidelity rate that is factored into the calculation where we must assure that we take responsibility of our patients more than 85% of the time, preventing them from going to the emergency department. So they're not really very truthful. We have a lot of red tape and a lot of obligations already put upon us. And clearly the system's broken. So I'm not quite sure how adding more and more bureaucratic red tape actually helps patients.
Well, hopefully these negotiations can pick back up and they can find a solution that works for all three parties, which is the province, the doctors, and most of all, the clients. Dr. Mark Bush, Medical Director and co-owner of Santé Montréal, thank you for joining us this morning.
Thank you.
I should mention we did reach out to Quebec's Ministry of Health and Social Services for a statement. We did not receive response in time for our conversation this morning. If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.